A practice that really supported me during my pregnancy was getting some of the ideas and thoughts out of my mind and putting them on paper, because I had a lot going on up there and a lot that I felt like I needed to figure out and get in line. And I also I felt like I didn't know anything about childbirth. And something that helped me feel more knowledgeable and more prepared was creating a list of birth preferences. And the word preferences, in my opinion, is really, really important, because it's not a birth plan. It's not saying this is the plan and we have to stick to it. And if it doesn't go according to plan, it's a failure. Going back to that whole outcome oriented thing, it's not about creating this like map. And if we don't follow this exact map, then everything's gone to hell. And so the preferences just mean if everything is lined up for this preference to happen, then I would like it to happen. For example, with medication, if you're moving through birth in a way that feels okay and comfortable to you, and you don't feel a need for medication, then you really want that preference to be honored, and you don't want to be offered medication. You want to be able to follow your path. And so it can be a really neat exercise to go through the different phases of labor and decide, if I could choose, what would I want during this phase of birth? And I have a template at the end of this module. It is in no way like what you need to have as your preferences. They are simply just ideas to jumpstart what you would want. So add some, take some out, change wording, throw the whole thing out and make your own. Do whatever feels good to you. And so I'm going to take you through the different phases of birth and just talk about a few example preferences and why some women might choose it, some might not, to kind of give you the example that there are no right or wrong preferences. And usually these are used for hospital births, but I still encourage the moms that I work with that are planning on a home birth or a birth center birth to create these, because it will inform those births as well. But especially if they make the transition to a hospital, it can be nice, if you have certain pieces of language that you want used to allow the nursing staff to be aware of those. So early labor. A preference that some women have is to stay at home as long as possible before they transition to the hospital. And what this can do is start a conversation with your care provider to let them know that this is important to me. If I can, I just want to rest at home and I don't want to be pushed to go into the hospital before I feel ready. And that brings up another point with the preferences is they create conversation between you and your care provider, and they allow you to realize what questions you have about birth, and it allows your care provider to share what some of their protocol is, what protocol they can change, what is set in stone, so you are more prepared for example, going to the hospital and knowing that, okay, their protocol is they always give the woman an IV. And you can ask, do I have to receive that, or can I say no? You're just gaining information, and it's not going to hurt. The more information you have about that, the more settled you're going to feel going into that environment. So that's an example of an early labor preference. Part of that is the Heplock. So it's the start of an IV. If you feel like having that needle in there is really going to distract you, you can ask to not have that. If you don't really care and you feel like whatever, if it's going to make the nurses more comfortable, let's just do it. Neither one of those are right or wrong. It's whatever feels best for you. And then moving into active labor. So active labor is commonly a time when a woman who would want to have an epidural gets it. If that is something that you don't want, you can have in your preferences that I do not want any medication offered to me. This doesn't mean that because you have that in your preferences, you can't change your mind and later request an epidural. You absolutely can. It's just saying that you don't want that shoved in your face over and over and over again. You want to be the one to request that. This is also a space where you would have the language preferences like I talked about. If, for example, you're somebody that doesn't want to be asked, how much pain are you in? How much pain are you in? Write that down. Say, I want you to ask how much comfort I'm in. Or instead of the word pain, I want you to use these words. Just sharing information about what feels important to you. The birth preferences are your space to do that. And then in the phase of labor where baby is crowning, coming out of your body, a preference that some women have is to not have really loud prompts to push. It's really common to have people saying, push, 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 and people are screaming and it's chaotic. And that can be overwhelming for some women, and that can be really empowering and energizing for some women. So think about what your preference would be. And if you want a really quiet, serene space, write that down. Say, I want people to maintain quiet voices during that final phase. I don't want anybody to be yelling the word push at me. Or if that's something that you feel like you would want, you can write that in there too. Like, I need a lot of encouragement and a lot of instruction during that final phase. And then after baby is birthed, you can have preferences in there for how baby is treated. If, for example, you don't want them to receive an eye salve that is protocol in hospitals, that would be where you would write it. And that would spur a conversation with your care provider, and they would let you know what protocol is and what would have to happen with that. So this is really, again, just a way to start this great conversation and to get really clear about the birthing environment that you're going into and what you can expect. And know that just because you're writing it down, it doesn't mean that has to be what you experience and that has to be what you do. You absolutely have the right to choose. But if you don't begin to create some kind of picture of, okay, if I have a choice, this is what I would choose, there might be somebody there that is going to choose for you. So in my opinion, this is a really empowering practice that you can do with your partner, with your baby, as you're looking through the template and you're adding things, taking things out. You can close your eyes in between and ask your baby, what do you think we would want? And who knows, maybe you'll hear the voice of your baby, or maybe it'll just be your intuition. I don't know. But allow that to be a bonding experience with your baby as you're creating the preferences. Same with your partner. And then you can take it to your care provider and then share it with your other birth supporters. If you're going to have a doula, your mom, your best friend, and make sure everybody's aware of what you would like, if possible.